As we look at all the hurricane preps you need to do today and tomorrow, an important thing to remember is a week's worth of medication.
Yeah, health reporter Haley Hernandez is joining us now. And Haley, what do people with chronic conditions need to be doing today?
Well, you know what? You need to get your medication into a waterproof container. And that being said, just putting it in a plastic bag really isn't going to cut it. I saw people coming into the George R. Brown during Hurricane Harvey with that. And by the time they got there, their medications were so wet and contaminated, they were unusable. So I want you to know how to better try and prepare in case of an emergency this week. Use a bag inside a bag or a bag inside a box. That's recommended to make sure your medication and important medical paperwork stays dry and clean during rain and flood disasters. And Dr. Donald Maloney, nephrologist with Memorial Hermann and UT Health, says if your home loses power, it's best to have a plan for moving medical devices or refrigerated prescriptions to someplace with power as soon as possible. For people on dialysis, he says do not miss your appointment today or tomorrow, as you'll receive critical information in the event of an emergency this week.
They will receive a packet at the dialysis facility that will include some of their demographics and some of their prescriptions that they should carry with them.
Definitely make sure you have this: contact information for the Kidney Community Emergency Response and the ESRD Network of Texas. You can call them with questions like what to do if transportation is unavailable, roads closed, how to get supplies, or what to do if your dialysis facility closes.
The major dialysis providers will also have backup facilities.
For people with heart disease or breathing problems, Memorial Hermann also recommends bringing catheter supplies and a blood pressure cuff in a waterproof container. Make sure oxygen tanks are full or request an extra tank through your healthcare provider. And right now I am working to get that information up on click2houston.com, as well as the emergency contact phone numbers that you need if you have a chronic condition. I'm also putting information on how to properly transport insulin if you need it, since insulin does need to be refrigerated. And if you were to ever get to a location and say the inside of your pill bottle is wet, but the pills look dry, I'm putting tips on when to know when you can still go ahead and take that medication and when it's definitely not okay to try and take it.